Hi, everyone. Thank you for joining us in a new episode of our People Power Health interview series. Today, we have an amazing guest, Dr. Apoorva Gomber. And we met recently because Apoorva is one of the first alumni of our heart cohort, our heart training program. So without further ado, I will ask Dr. Apoorva if she can introduce herself. If you walk into a room, how would you introduce yourself with the people in the room?
Oh, wow. That's interesting. So maybe I'll dress up more professionally for that. So hi, everybody. I'm Apoorva Gomber. I'm a physician originally from India. So I was born in Delhi, in India, and coming from a family of doctors. So I consider myself really privileged. There was no other option but to be a doctor for me. So I'll take it. But when I enter a room like this, I think the first thing I introduce myself as is that I was always driven to be a doctor. I always wanted to be one. But more than that, I'm also a person living with type 1 diabetes. So I share both sides of the table. So I know the experiences that goes along. And also that I've been really passionate about global health. That's what brought me into this space, and ultimately got in touch with you, Sam, and the amazing work which you all are doing with people power and like the entire advocacy efforts you've kind of driving around it. Thank you.
Amazing, thank you. Okay, so then I'm really interested in getting to know more, and I'm sure our audience will also love to know a little bit more. How was it growing in a family with lots of physicians and healthcare professionals in India? How was that? What else could you share with us about those years of your life?
So yeah, it's exciting. So I was the firstborn in my family, and both my parents are doctors. So it's like not like a big family. So both my parents are physicians, and being the oldest, like it's a trend in India that only the firstborn has to follow the parents' footsteps. So I had no other option but to be a doctor, though I was creative, and I thought, how do I bring creativity into medicine? But that's how I followed this path. And I think in India, like medicine is always like considered as a really like a really sought after profession. So I was always driven to do it. Looking at my parents, even though they never had time, they were always busy. We didn't go on vacations because they were always busy. So I think that's how I was like, okay, this is what I want to do. But also, while being in the medical school, like I think I realized that there are different ways of like getting involved into the space. I was exposed to global health opportunities. I also I really thank that being a person living with type 1 diabetes, I was more driven towards like understanding the people's experiences on that side of the thing, which drove me towards other policy spaces, health systems, because as a physician in training, I felt really really sad that sometimes you need to change the system to make real changes happen. And as a doctor, sometimes you're paralyzed. Even if you want to help the people, the system doesn't allow you. So all kind of like those narratives really helped me drive towards global health. And that drew me into the intersections of advocacy, in the intersections of like how medicine is not just about giving or prescribing a drug, but also thinking about the social determinants that need to be integrated and empowered. And we can help people way better that way if we close the loop and the continuum of care that way. Yeah.
Exactly. And before we move on into some of the amazing work that you have been doing in recent years, I would like to ask you, is there any particular story or any particular moment during your years in medical school that you remember that you could share with us?
Oh, there've been amazing moments, I would say. I love the time in medical school. And I'm biased because I also met my partner in medical school. He was he was my batchmate. We were friends, and like we evolved, a relationship evolved in medical school in a library. So I
Wow.
love the time. The experiences that really drove me towards this, and like one experience really like comes back all the time. And I've also written an article on it when I was like, as a medical student, trying to like just vent out what I was going through that time. So like I mentioned, I was diagnosed with type 1 diabetes when I was as a teenager, and got into medical school. As a female, faced a lot of stigma in the community, because that's the norm, like cultural norms, that a female kind of like has to face some kind of challenges living with a chronic condition. And it's not really acceptable. So the culture kind of like makes you stigmatized, or like as a negative approach, that you're misfit, and you don't meet the standards of like being called an ideal candidate. And like, India has a lot of like arranged marriages and stuff. So all those conversations keep on happening. But like when I was in medical school, so they were like, we were on clinical rounds, and they were like patients that used to come, and I came across some type 1 diabetes kids I had never seen like all that while. But when I was in like fourth year medical school, they were like, when on clinical rounds, there were patients that came with type 1 diabetes, were given diagnosis of type 1, and you will be surprised to hear this. The parents just abandoned those children because they said, we don't have money to take care of this. It's better this person dies rather than be a burden on our family, so that it's not a financial burden. We can carry this. We don't have food or even money to like give them insulin. And that really like, that kind of like questioned me, that if I wasn't born in a family of doctors, if my parents wouldn't have invested in me, I wouldn't have been here standing on the other side of the bed. Mm-hmm. I would have been someone who would have been abandoned on just because of having a diagnosis that wasn't my fault.
Sure.
This kept happening. It wasn't one incident. There were like multiple incidents. And also bringing back the female perspective to it, mostly happened with females, because yes, in India, there's this thing that, oh, the females need to be married off and like sent off. So why do you want to spend so much money on a girl? And they don't want to spend money because she's ultimately going to have a shorter life, more challenges, getting into the hospitals, being a more bigger burden. That was the narrative. And that's why females were way more commonly seen in that. And a lot of people used to hide their disease amidst that conversation. So even like, you're thinking that I was very open about diabetes. I wasn't. It took me a really long time to also open up my cocoon of talking about diabetes, because yes, it was a stigma, and I couldn't proudly say, oh, I'm someone with type 1 diabetes. But I was hiding it. My parents always rebelled with me, like, why do you want to tell the world that you have diabetes? Why can't you just keep your mouth shut? But then I wanted to, because I felt that if we as educated people won't speak about it, nothing will happen. No change will happen. And today, if one person is being abandoned, tomorrow so many kids will just be thrown away. And that kind of like really changed my narrative. Now, coming back to another incident, which really like pulls me towards it. There was a little girl that came into the hospital. This was like when I was doing my residency. So like we're 3-4 years ahead now. And during residency, so I did start a community of people with type 1 diabetes, so they can like meet people and everything. So there was a little girl who came, and because of the cultural stigma, some people stopped insulin for their kids. So this little girl was admitted to a pediatric ICU with multiple infarcts in her brain, cerebral herniation, which is like the brain kind of like herniated into her spinal cord. And while taking history, they said, oh, we did not have money. That was their question, that we did not have money, so we couldn't buy insulin for her. So we stopped insulin and we started giving her herbal medicine, because somebody said that if she has to die, she'll die peacefully eating that herbal medicine. And in that midst, she landed up in a condition called diabetes ketoacidosis, where the blood sugars become really high, the brain swells up because it holds water, herniated. She was like 12 years old, probably. She lost left side of her entire like paralysis. She did recover, but she couldn't be a normal person only because of that one mistake. And she had come before to the same hospital. And the doctor could see that they were having some challenges in understanding that they don't want to take insulin. And this was like something which was about to come. Like it was like something in your hands. You could have stopped, but you couldn't, just because the parents didn't want to like really didn't want to make an effort for a girl. And also, yeah, the expenses. So there were certain things which as a doctor you feel as a failure because you were the treating doctor. You couldn't do it, and also the system kind of not did not allow you to make that happen. But that girl completely, like, she's still alive, but she's disabled because of her left side of the body doesn't work. She wanted to be like, she wanted to walk the ramp. She said, like, I want to be a model. But now, like, all those challenges, she still can and she will. Like, but sometimes the places where you're born, your geographical location determine the care you get. And that's not, like, that's morally not allowed, and that shouldn't be allowed. So we need to kind of change that narrative. And I think that's where my interest kind of like drew me towards activism, and like, we need to do this, we need to change this. I alone cannot save the world. I don't want to. It's a too big a job. But I know collectively people getting together who share the similar narratives and similar challenges coming from different sides of the world can really make this happen. And I think as a role, my role doesn't only come as a physician, but also as a person living with diabetes. And I think I do feel privileged to be in that role. I don't consider that every doctor should be thought as an expert in their disease area, but like, I feel even people living with should be integrated and should be given that expertise to share, because sometimes you don't read all this in medical books like Harrison or Davidson or anything, but these are like lived experiences and lived opportunities where people can really tell you what to do.
Exactly. No. I completely agree. And the other thing that I was going to ask about, so we are now moving into what is your current work and what you have been doing in recent years. Mm-hmm. And one thing that I want to ask you is, thinking about the world where we are living now and how non-communicable diseases are sometimes neglected because there are other kind of diseases that maybe gather more attention or more resources or different support. What is the point of view that you have related to that? How is the world currently working and doing stuff related to NCDs? And what are the next steps that Dr. Apoorva Gomber is considering that should be taken, and what we as a community need to do?
Yeah, thank you, Sam, for that question. And I think it's really exciting to see what's happening, like the change in narratives of like how NCDs are now getting little attention, not 100% attention, but yes, there is in the policy space, there's conversation happening. For people who don't know about NCDs, so non-communicable disease is like a big umbrella term. It's not like that all NCDs are chronic conditions and all chronic conditions are severe conditions. Like, it's a big bucket, and when it's not communicable, like, you just put it in that bucket of NCDs. And that's why it's a big bucket of people. So people don't know what all really comes into that. But unfortunately, it's a bigger bucket, but only has a portion of the global health budget allocated to it. Because yes, people think HIV is a bigger priority. I don't want to take attention from that, but because that is a bigger priority. There is also infectious diseases like COVID and all of those diseases that keep coming up. Those are bigger buckets, but also we need to think that majority of the people are living with a non-communicable disease. For example, diabetes. Diabetes is not one type. It can be multiple types, can happen in children, can happen in adolescents, can happen in adults. So it's like the whole continuum of care is completely affected. That's why the burden of non-communicable disease is way more. Hypertensive, I think everybody probably, it's sad to say this, but everybody in my family or probably in my friend circle would have somebody with a non-communicable disease. Like, it's sad, but it's true that this is the burden is so high, but the budget is not much. And it's exciting to see now now the health systems and the communication around it is finally driving more attention towards it. Also because COVID kind of drew a little bit of attention of people with non-communicable disease like diabetes or hypertension were more had poorer outcomes or had poor mortality rates. So all of that. So that really helped. So coming back to the context, I think, yes, NCDs need to be really prioritized right now, because we know it's important and we're seeing it all by ourselves. It's not just that you can get best of the resources available and NCDs will be fine. It's not like a cure, basically, because people live with it. It's so deeply rooted. That's what makes NCDs really complex, is because it's so deeply rooted to the social determinants of health, where you belong. Do you have access to good food? Do you have access to education? Do you know how to inject insulin? Do you also have like oral medications available? Also, there's a huge, like, I'm really like, it boggles my mind, but we live in a very disconnected world at once. And I've had the exposure of working in India and also now working in the US. Because in India, like, people have to dug the ground to get a vial of insulin. They don't have refrigerators, so they store it. But here you have everything. You have best of the technologies. You have closed loops and like best technologies. But still, there are so many disparities even within the US and a high income country that we don't really see. So I think there's no one solution to managing NCDs. And you said how we can help, how I can help, or how a community can help. I think everybody has a role here and everybody holds a piece of a puzzle. We cannot complete this puzzle without having everybody on board. And that's why I think people who are living with, people who are also in the community doing non-professional work really mean a lot, because what kind of food, what kind of resources, education, school support a person's getting, that also plays a huge role. What happens inside a clinical doctor's room, like when you're prescribing a medicine, how is the other side of the things kind of like being answered? So I think that's why it makes diabetes and other non-communicable disease really complex, and we're trying to solve it. So what my role currently is, I am really fortunate to work with an amazing team at the Center for Integration Science, Brigham and Women Hospital. So we work in the Division of Global Health Equity along the intersections of type 1 diabetes, sickle cell disease, and rheumatic and congenital heart disease. So all of these kind of are very much related to, these are NCDs, but we consider them severe chronic, because if you don't have care for these conditions, it's almost like a death sentence. And we've been trying to, like, no one's talking about the poorest billion. So these poorest billion people, which we categorize, are the ones who are structurally, like, because of the structural challenges, and have not been cared for, or because of poverty, they have been separated from the usual care model. So that's why we want to really target, I think the PEN Plus is a care model, which basically integrates the care for type 1 diabetes, sickle cell, rheumatic, and congenital heart disease by bringing care to the closest possible center for people. So it's also important to realize that all the care for these conditions are very tertiary care focused. So people have to travel long distances to get care. And in the delay of getting to that tertiary care center, often people are lost, or they just don't want to do it, and they silently like give up. And it's not that it's not common. It's very common. People have done that and they don't reach the nearest center and they die even without getting a diagnosis. But people have, these are like real challenges. So what PEN Plus is, which is an integrated care model, also been adopted by WHO now for the Afro continent. We are trying to encourage adoption of this model, so care can be delivered for the people who are in the poorest billion, so that people who always had no solution for type 1 diabetes can get care, can get awareness, and also can live with the condition, and not just live, I would say, rather like thrive with the condition overall. And eventually, I think my long-term hope would be to see everybody with, like, because I'm biased with type 1 diabetes, so I want everybody to have a normal life, because it's not easy living with type 1 diabetes. It's isolating, it is challenging, but there's also, like, you can empower other friends, a community of people, and then you can thrive as a community. I think our role is to ensure that we keep holding hands, building global solidarity around it, because your geographical location shouldn't determine if you should live or not live. Ultimately, as activism, like just how people in the HIV movement kind of like really boldly like created that narrative, I think people in the non-communicable disease or I can say for type 1 diabetes, can really build that movement. Because few years back, I would say 10 years back, people used to say, oh, type 1 diabetes is a rare disease in low middle income countries. It's a disease of the West. It doesn't happen in like people in India or people in like low middle income countries. It is only like people who eat too much food or too much, like it was considered like that. And you're like less than 3% or 4% of the population. We have bigger fishes to fry right now. Like if you think about the policy conversation, this is how it was. And now that people are finally surviving, they're living with type 1 diabetes. You can see an adult with type 1 diabetes who has lived through all these conditions, all these challenges. You can see it. And then I think when you see it, you're like, oh my God, the burden of type 1 diabetes is rising. Like it's a lot. And like so many people are there. It's only because people are finally getting the care they need, and they're able to survive that long. I think as a community, it's important for us to understand how we can improve the care through social determinants, ensure everybody has education, everybody knows what to do, when to do. Do we have school support for people living with the condition? And also stigma, how we are talking. There's so much discrimination around people living with the condition. So as a community, that's where the role comes in. And peer support is a huge piece that needs, nobody should be living alone with diabetes or any chronic condition. There's a community out there. All we need to is just hold hands. And I think last piece of advice, I know I speak a lot. So.
No, that's perfect. Go ahead.
I think last piece of advice would be like, I think, like I said, nobody can do this alone. We really need to like find newer ways and opportunities to do it. And activism and people getting together is a great way. And we've seen that from the HIV movement as well. So to push agendas in the policy space, you need to just keep looking for the window of opportunity to make it happen.
Amazing. No, and then one thing that I want to ask you, and it's following up on your last comments, is if there is someone like watching this interview right now, and they are wondering and asking themselves, what could I do? Where can I find more people that are similar, in the similar mindset? What kind of comment or advice would you give to those people that are right now watching this interview and thinking about, I want to do something else?
Yeah, that's so interesting. And I think that was my mindset too, when I was looking for people, like I want to do something and I don't know what to do, but I want to like look. So I think keep looking. Don't let that fire inside you stop burning, because I think change happens when you keep looking for it. And when people want to like find opportunities, everything is out there. It's about like when you speak to people, certain things come up. I think for me also, like when I look back at my journey, there wasn't a straight path I followed. It was like speaking to people, answering about certain things or finding about it. I think I also jumped, while looking into it, I jumped across the program we did around the heart. I think that was also through because I was looking into the space, what's happening. And there's very few people who are doing that work. So you will eventually jump into it. You will jump into the same group of people who've either done some advocacy in the past. So I think that's how you keep looking around. I can talk about if somebody wants to get in the NCD space, there's so much momentum out there. UNGA, United Nations General Assembly, is talking about it. There's NCD Alliance. There's Harvard Global Health Institute talking about it. There's the Division of Global Health Equity talking about it. So Center for Integration Science is managing NCDs here. And also Pen Plus is like now being adopted as a really good model of integrated care. So there is like momentum out there. So if somebody wants to help, I think reaching out, sharing what you can bring to the table, because there's no one way to save the world right now. We need to think about different opportunities, different ways to like make things better. And sometimes like we don't even have we never even think about certain solutions, but that could be a solution, and we just need that door to be open. And maybe someone right now listening to this interview could help us open that door for us, and we could just build on the movement together. So yeah.
And one last question related to this answer. if you could share a little bit of your experience with heart, like for people that are wondering what's heart, what is she talking about? A little bit of your experience, like maybe some of the guest speakers that you remember, or a topic, or some of your colleagues, anything that you would like to share with us about heart.
Yeah, it's fascinating that I came across heart last year. So I'll tell you the reason why, because as a healthcare professional, sometimes you're not taught in medical school about activism, though medicine really puts you in a place of power, but nobody teaches you how to maximize that power, or like train you in that power, and that you have a role. It's not about just prescribing a medicine, but like you can make real changes if you want to. So I was looking into opportunities, like while like going into the like, I think it was like a rabbit hole of just like searching, and I was like, how activism and like medicine can kind of relate. What's the role of physicians? And I think heart was like also something around the intersections. So heart is health equity activist. So what is our
Reflection training?
Reflection training. So yeah, that's where you are. So heart is basically about reflecting on like how you can maximize your own power as a physician, also understanding how you bring a health equity lens while being an activist. Yes, I consider myself activist, but I don't know how to do activism because there's no cookie cutter approach to do it. So everybody has a different way of doing it. And I think heart really brought that, like when I was reading about it, it really clicked my mind that, oh my God, I really need to be with these people. They have such wealth of resource on organizing and how to do it, which probably I never read in a book or in my medical school. So this can really help me build on it. And I think this really helped me build that narrative of like how we can learn. And some of the sessions that were shared and some of the conversation that you and Petra really talked about was so interesting, because I always like turned off the video, like turned off the session, and it made me think about, oh my God, why did I never think about this? This is such a great opportunity to leverage on. And yeah, there was some conversation on climate and other things, but I just was really interested on the NCD side of things. So even if the discussions were more on the climate side, on like what's the role of like health activists or medical professionals who have a knowledge of care, how can I shift that towards NCDs? That was my always like homework to do it. And that like in my homeworks, I was always late, but then I did bring up NCDs every time, because yes, I really want to make change happen there. And heart really helped me go back home and like think about how I can make a meaningful difference. And I'm still figuring it out, and I think everybody is figuring it out. But eventually we are way better than what we were before. And I feel after the heart training, I am a little one step ahead in my understanding of how we can make a difference. And I would love all the training possible if you have a part 2 course coming up too.
Amazing. No, thank you, Apoorva, for that. And just before we finish the interview, because I know you have another meeting coming up, we have some short questions that I love to ask people that I am interviewing. And the first question is, if you could have a meeting with any person, dead or alive, from the history of the world, who would that be?
Oh my God. Why am I not prepared for this question? Like, you should have told me about this.
I mean, anyone that came up to your mind. It could be someone in the healthcare field, or maybe someone unrelated to the healthcare field, but maybe with some like social justice or activism or something else.
Oh, yeah. I can talk about someone really recently because I really regret that never happened. So I wish I could have had a meeting with Paul Farmer. I never met him in person, but I always read about him. And I was in the same, like I work in the same division he was working with, that I work with. My boss is like really close to him, and I always wanted to meet him. But I don't know what happened. I missed the chance and the opportunity to see him in person, though I attended a lot of his lectures. So like lectures virtually, but
Yes.
never had a chance to like meet him in person and like ask him like what more. Like because I know he wanted to change the world. Like
Yes.
something in him kind of like drew him towards it. And like activism is a very lonely, isolating piece as well. It can exhaust you. I just want to like ask him that question. What keeps you going? Like, tell me that. And I wish I could have asked him like and hear his response, but I couldn't.
No, I feel you there, because I'm sure a lot of people, we wish we could have the opportunity of meeting Paul Farmer. Okay, Apoorva, and the last question: is there any media, like a book, a movie, something that you will recommend people that they could read, that they could watch as they go through this journey?
Oh, I don't have one book. I think there's so many things out there you could read. It can start from somewhere. There's so many stories of people out there. Um, I do watch a lot of like videos on like how people can like understand narratives of people's experiences. I did come across one book from Arthur Kleinman, Illness Narratives, that really helped me understand how like healthcare professionals need to see the other side of the table as well. I didn't think that this kind of thing existed, but I didn't know that Arthur Kleinman like wrote this like a couple of years back. And so that is a great book to start with. And also about activism, I think it's such an evolving piece. From the HIV movement, there's so much to learn. I still haven't learned all of that. I haven't read all of it, but I think the HIV movement teaches you a lot, and also about like organizing. There are a lot of books around it, and yeah, everybody has a different way of doing activism. Also, I think you kind of like have to pick pieces of everything you read. So that was one thing. I don't know about documentaries. I'm really bad at remembering names of documentaries, but there are really good documentaries out there as well around it. Yeah.
Amazing. Thank you. No, thank you, Apoorva, for this time, for this conversation. And we invite everyone to keep joining us in this People Power Health Insight interview series. And again, thank you, Apoorva, and see you everyone next time.
Thank you so much. It was lovely chatting with you.